If you can manage to get a little sleep during this, please feel free. This is a kind of inhumane hour to get anybody to listen to a talk about alcohol. The outermost part of the brain houses reason, the intellect. Beneath that, the emotions, the imagination, the memory. Deeper still is that part controlling your motor activity, the movement of parts, your arms and legs. There are the semi-voluntary functions, like the blinking of your eyes. At times you have control over it, at times a gust of wind, you blink involuntarily. There are purely involuntary functions, the action of your stomach and your intestines. And then from the Latin word vita, life, there are those functions essential to life, which we call vital, your heartbeat and your breathing. Now, the brain goes to sleep from outside in. It can be done almost instantaneously, but step by step, that's the way it goes out. Everybody here also has some notion, and correct, I'm sure, of adulthood or maturity. An adult is somebody with a sense of responsibility, or one who tries to fulfill a sense of responsibility. An adult is someone sensitive to the sensitivities of other people. Cardinal Newman's classic definition of a gentleman, one who does not consciously cause pain. Dr. Green's definition, one who functions this way. According to the formula I over E, his intellect controls his emotions. Going along with the entire school of scholasticism founded by Aquinas, man is a rational animal. Now let's see what happens to that formula when the brain that controls it is interfered with by adding a drug to it. First of all, there's a dryness in the throat. It's highly absorbent of moisture, dries out those mucous membranes, and you get this vague sense of suffocation. You want to rip the mask off and gulp fresh air. But before you can do that, you feel good. Whee! Get the picture. You have just left your room, clad in what is euphemistically called a hospital gown. I think they're obscene, personally. Then they put you on a hard metal cart, and guess how you get to the operating room? No one has ever explained to me, from hospital designer, administrator, doctor, or nurse, why in the most modern hospital, where they perform surgery all day, every day, there's no such thing as an elevator for surgical patients. You go down on a public elevator. There are always about 3 or 4 clowns doing one of these on you as you go down. Then they wheel you into the operating room where there are 6 ghouls. And they're standing there in cap, mask, and gown, and guess what color? You know, some psychologists have earned their doctorates writing theses on color and how it affects morale and so on and so forth. After 92,000 launderings, these hospital gowns now are vomit green. And you're there with an empty belly at 8:10. And then the fellow who used to be your friend the night before walks in this way. They're going to stick a knife in his hand, he's going to stick it in your belly in about 30 seconds, and you couldn't care less. If the nurse were to bend over and say, you know, we're going to have to remove that whole arm, you'd say, take them both, I've got legs. You would. It doesn't bother you. And the reason is the simplest in the world. The first part of the brain that is hit is what would make you feel bad. Reason. It's now gone. In fact, they give you a needle before you leave the room. You're half flaky by the time you get down there. So it's I over E except after D. Add a drug and watch what you get. This is highly important. Control over the emotions is now gone. What happens is they come out. You have a reversal of a formula and immediately enter an excitement stage. And with your motor activity affected, since you could harm yourself, that's why that sheet's wrapped rather tightly around you, and that's why the medical personnel are now standing close to you. Watch this. The emotions have come out. This is why you say wacky things. This is also why medical ethics forbids them to bear outside that room what you bear inside it. And the reason is the simplest in the world. When the emotions come out, they do not come out, let's say, normal, if there is such a thing. They come out drug affected, because that's the next part of the brain hit. They come out drug affected. Now let me ask you a question that might sound silly and stupid, but it's very valid. How many of you, listening to a patient babble on a table in an operating room, would say, good heavens, he needs a psychiatrist? What would you think of psychiatrists who go wandering from operating room to operating room trying to apply psychiatric care? You say they need help themselves, and you'd be right. But just bear that in mind for a minute. You may or may not get sick, that's neither here nor there. Since these two things are dangerous, they try to slam you through them as quickly as they can. There is, however, a nurse there with a basin to catch anything you have to offer. Normally there won't be. They keep that entire intestinal tract empty. Beginning the night before, by use of the most sophisticated medical technique known to God and man. It's called the enema, is what it's called, and good. Personally, I think it's inhumane and barbaric, but I don't know of any other way. I had 6 in 3 days one time. I was in for a complete checkup. And by the 4th, when that fellow walked in with the 4th enema, I saluted him. I downstairs. I called him the rear admiral of the 4th floor. That to me is as irritating as the surgery itself, really. But when the semi-voluntary functions go, you are in pre-anesthesia, simple unconsciousness. You cannot yet be cut. When the involuntary functions go, you are in anesthesia and can undergo surgery. The next step is obvious. The only thing left is your heartbeat and your breathing. And I have heard every surgeon who has ever been to one of these meetings has always come up afterwards. He says, I wish to heavens people would realize that despite the nature of the surgery, if you undergo any surgery by general anesthesia in which your brain is sedated down to here, there's no such thing as minor surgery. You're as close to death as you will ever be. This is why, to keep a person between anesthesia and death, because death results when the vital functions go, is highly dangerous indeed. Most anesthesiologists are MDs who do nothing but this. Coming out of it, you go through the same process in reverse. From anesthesia to pre-anesthesia, you'll be sick and you undergo an excitement stage. Ether is terribly conducive to nausea. This is why they use anything else they can. And part of the sickness, particularly after abdominal surgery, is this phenomenon called gas. Oh. Those of you who have experienced it know what I mean. And if you haven't experienced it, you can only imagine. In the middle of the first day after surgery, you are afraid you might die, and in the middle of the second one, you're afraid you might not. And I'm dead serious about that, too. You do not care if the next minute of your life shows up or not. And you know what happens? A surgeon friend of mine explained, he says, you come too, but they don't for about 3 days. This is why they try to get you ambulatory and why they try to get you to eat and so on as soon after surgery as possible, to activate those things. What causes the pain is the distension of the intestines caused by gas. You can cut an intestine without feeling it hardly, but just distend it ever so slightly, which is what a cramp is, and the pain is almost unbearable. Now, watch. Standard medical procedure. You go to recovery room till you're conscious, then back to your own room, and as soon as this team of usually about 4 or 5 pros gets you back into bed in almost a split second, the first procedure performed is a massive dose of morphine. Is to prevent hurting yourself in the excitement stage, and also, and quite obviously, to alleviate the pain. Now, there will not be any euphoria for obvious reasons. Now watch. I have never ceased to be impressed by this. Cross out ether, substitute alcohol. It does exactly the same thing. Ladies and gentlemen, please remember this. As such, this has nothing to do with alcoholism. This has to do with alcohol, what it does when you drink it. A biochemist showed me this about a month ago. To get ether, what you do is you take 2 alcohol molecules. Here's one. Now watch. HO, C2H5, and you remove the water. H2O. That's ether. Practically speaking, one is the other without the water in it. And by the way, this is just a personal thing for those of you who are parents. You cannot teach your children how to drink. And if they are teenagers, your capacity to teach them is long gone anyway. What you have to give your children, number one, is a sense of values and proper attitudes. And then you hope to God that when they hit their teen years, when they will choose, that they choose responsibly. And that's what you have to give your children. Attitudes and a sense of values. That's it. Well, how do I teach my children to drink? You don't. When I'm asked that question, I say probably the same way you teach them to use goofballs. This is a drug. Now, it comes in beverage form. Please remember that. God gave it to us in that form. It is simply what it is. You don't use this information to scare kids with the fear tactic. It will not work. They know that most people who drink do not become alcoholics. They'll turn you off like that. Anyway, the first thing we feel with alcohol is the first paradox about its nature. It's a liquid that dries out your throat. Now, for those of us who know it all, did you ever say, here, wet your whistle? Well, it doesn't. It dries your whistle. The chaser wets your whistle. That's why we invented it. That's why we invented a mixed drink. To do away with the unpleasant burning sensation caused by the dryness and the irritation, and also to make it somewhat palatable. Now, if you don't, of course, beer and wine have a kind of a minor percentage of alcohol. It's the spirits, you know, that hurt. Now, if you've never experienced that, try it with a straight shot when you go home. Or if you don't care to, go to a football game and watch the reaction. There's some clown up in the stands with a half pint, and he takes a big smash, and you get, oh, that was good. And the tears are streaming down his cheeks and so on. Well, that's what happens. It dries out the mucous membranes of the throat because it's highly absorbent of moisture, and it causes this irritation here. However, after a while you'll feel good, then you don't mind the burning. Now, why do you feel good when you drink alcohol? What is not oxidized by the liver gets into the bloodstream, and the blood ultimately brings it to the brain where it begins to sedate it. How do we know? Simple observation. Dr. Green is not teaching anything here. He's pointing out to you what you already know. Let me ask you this. Do you know when you're in a room full of people drinking? It's obvious, isn't it? Somebody very drunk staggers. And by the way, alcohol is noticeable. I just can't buy this stuff. People say, you know, I know a guy drinks 18 gallons a day, and you'd never know it. Well, you'd probably never know it because you've never seen him sober. Did you ever hear that story? And I'm sure the Navy men here are familiar with it. The fellow, the first mate or whatever, who keeps the log. The captain was drunk today, the captain was drunk today. This went on for years till the captain discovered it. He says, don't put that in there, so the fellow didn't. So I think it was 8 years later, there was an entry one day, I think it was July 13th. The captain was sober today. You feel good when you drink because alcohol knocks out of the picture what would make you feel bad. This is why it's a marvelous escape from your problems. This is why. And people feel good. You can see it. You can see it. And here is where you see it. Did you ever see a drunk try to light a cigarette? It's a major production. to watch him zero in on the end of that thing. But before he gets drunk, in Canada, one of the finest films on alcohol is a thing called .08, about blood alcohol level. They used professional racing drivers. They gave them 2 shots. That's it. Put them behind wheels of cars. And then they had to go through one of these obstacle courses. These are professionals. Professionals. And one man was actually cussing himself because he's knocking pylons over. He felt he was functioning well, but he wasn't. And this has to do not with alcoholism. This has to do with you who drink. You do not function better with a couple of drinks. Because you feel you function better doesn't mean you do. Well, I drive better after a drink or 2. No, you don't. You drive more relaxed. You do not drive better. There's that split-second difference getting your foot from the accelerator to the brake. There's that weaving of the hand, getting the key in the ignition. Where we notice it, you can see it in people, that slowness of the blinking of the eyelids. And then with the motor activity affected, the tongue gets a little bit thick, just ever so slightly. Now, we smile, never. This is the way it hits people who drink it. This is the way. Here's a fellow, he comes home from work. Now, he's not really a drinker, but they're celebrating something. He's with some of the fellows. He has about 9. Well, of course, he walks in an hour and 3/4 late. The dinner is burned. She's furious. She says, "You've been drinking." He stands there swaying. And he says, "Well, I mean, just how can you stand there with your face hanging out that way and accuse me of drinking?" He thinks he's functioning perfectly. So do you when you drink. So do you when you drink. Now watch. We see funny behavior in drinkers because the emotions are now up here. All right? And previously intelligent people are now saying real nutty things and repeating themselves. Now, if you want to know what I mean, go to your next cocktail party and don't drink. After about 3/4 of an hour, you either want to throw up, go home, or get drunk yourself, just to take it. Significant is this. Please remember it. After a couple of drinks, we think we've discovered truth serum. It's been around for centuries. It's called booze. And the Latins, 8,000 years before Christ, had an expression, in vino veritas. In wine there is truth. You want to know what somebody drinks, give him 4, or know what he thinks, give him 4 or 5 drinks. In other words, fear is out of the way, the inhibitions are gone, but you're not yet down here. And so you talk freely. However, after a few more drinks, now watch, please. When the emotions come out, they come out drug affected. They come out drug affected. We are looking at goofy emotional behavior. Now let me ask the same question that we laughed at before. How many of you have ever looked at a problem drinker and said, he needs a psychiatrist? And how many people in high places have spent fortunes on valuable personnel sending them to psychiatrists who are very wise by... Well, no, that's neither here nor there. But just let me ask you, what do you think of a psychiatrist who would never dream of trying to treat somebody under the influence of ether, but tries to drink actively practicing alcoholics? This is important. I'm not saying that psychiatric therapy isn't necessary. What I'm saying is this, that first, sobriety. He does not need psychiatry now. He needs to get sober to find out if he needs a psychiatrist. How would you know whether a patient on an operating table needs psychiatry for his personal, emotional, and mental problems? You say, for God's sake, get the ether out of him and examine him. It's the same way with the alcoholic. Get the drug out. Good Lord, he's been bathing his brain in a drug for 15, 18 years. He needs sobriety to find out if he needs psychiatric care for his emotional problems. Dr. Green has said this, I have seen borderline psychoses clear up with sobriety. It is not whether or not he needs it. Some alcoholics do. In fact, Dr. Green and everyone who has ever done a study on it has found out that the percentage of alcoholics who do need psychiatric attention is exactly the same as the percentage of the non-alcoholic population. About 7 to 10% of all people need care. So, the conclusion, in the initial stages of recovery, psychiatry is contraindicated. Get him sober first. Dr. Green used to say, of those who do need care, he put it semi-crudely, but truly. If you were nuts before you started to drink, you'll be a little flakier after you quit. and you will need subsequent care. All right? With the emotions on top, affected by the drug alcohol, this is what we see. Whatever you are basically here, exaggerated. There's the jocose type. The life of the party. Very shy. Can't get through his own name, making an introduction. Give him 5 drinks, he's on the piano leading the songs. There's the bellicose type. The little teeny fella with the Julius Caesar complex. Very quiet, very subdued, very shy, very diffident. Give him 8 or 9 bangs of this liquid moral courage and he's going to challenge the entire bar. As we say in AA, you can spot them. They're usually the new men with the new teeth. Then there's the lachrymose or crying drunk. Have you ever met one? If you'd like to, you put on a Roman collar and get on a train. You get in the last seat, way back as far as you can get. And after the train pulls out of the station, about 3 minutes later, some clown steps in from the club car, and he spots that 1 square inch of white. Many a drunk who is very drunk can't quite focus. They tell one of a drunk going down the street and 2 nuns walking up. They didn't know what to do because he was staggering. But when they got near him, they separated and went around him, and he stopped and said, "Now, how'd she do that?" Of course, he can't quite focus, but anyway. You may or may not get sick as you drink. That's neither here nor there. You do not have to get sick. But if you drink enough, you will pass out. 3 paradoxes about alcohol. It's a liquid that dries out your throat. It is a sedative that seems to stimulate. And it's an anesthetic that can't anesthetize, precisely because it's a liquid and must be drunk. And when you drink down to unconsciousness, you can't pick up the glass to get you down to here. How then does alcoholism kill? Through cirrhosis, through malnutrition and all that they give birth to. And also, oddly enough, a doctor told me this about 2 weeks ago. He said many an alcoholic will choke to death on his own vomit. He'd be lying on his back and just regurgitate a little bit of his supper and choke to death on it. And secondly, or lastly, by accidents. Alcohol really kills through accidents. Coming out of it, the drinker goes through the same process in reverse. Pre-anesthesia, nauseated. He'll undergo an excitement stage, but will not experience euphoria. Very briefly, before we come to the end of this segment, let's look at 2 people who go through this process. Charlie and his Aunt Mabel show up for a New Year's Eve party. Now, Charlie's the alcoholic. Watch. He burns his throat, feels good. For a while, he's the life of the party. Changes into Filthy McNasty. Somebody bangs him in the mouth. He cries in his beer and then passes out at 11:30. This is significant, ladies and gentlemen. He did not intend to be unconscious at midnight. He intended to see the new year in, but he's out. What do you do with a drunk? This is very quick and it's very practical. You put him in the car, his. There's a very practical reason for this. Most alcoholics do not eat because they cannot. But it is a New Year's Eve party, and there's the traditional pickled herring. He's nibbling all this stuff. There are raw oysters, deviled eggs, 92,000 cheese dips, nuts and pretzels and so on. And it's all sloshing around with the VO here. Now, about 3:30 out in the car, the cold is going to wake him up. He will then sit up, wake up, and throw up. You make sure it's on his upholstery. Never put a drunk in your car. And I'm serious about this. The second thing is, he undergoes the excitement stage, and at about 3:45, everybody's ready to go home, and here's Charles at the door. "I want a drink." Now, you've heard that. And guess what the wife always says? "Charles, you've had enough." Here's where 2 people say to each other what 2 animals wouldn't. Dr. Green's second piece of advice is the most normal, natural, and intelligent in the world. He says, "What do they do in the hospital?" Knock him out with morphine. He says, "For heaven's sake, give him the drink. Make sure it's that big." For 2 reasons, and they're very solid. Number 1, he'll get it. And number 2, he's got the keys of the car in his hand. He's going to drive. Millions, literally millions, are now being spent trying to reduce alcohol-related highway crashes. Over 50% of the carnage is caused by alcoholics, and over 50% of pedestrians killed are alcoholics. All right, now Charlie's out of the way. Let's look at his Aunt Mabel. There's one in every family, ladies and gentlemen. She's strong-willed. She can't understand his addiction because she doesn't have it. And most non-alcoholics can't. They can't. It's like me and gambling. I do not understand gambling. I can grasp it up here, but down in here it means nothing. I just can't. I don't understand it. There are 5 addictions, you know. Narcotics, alcohol, food, and then the 2 purely psychological ones, gambling and work. Did you ever go into a lady's house and she empties the ashtray 17 times? Seriously. And you don't smoke.